So hey guys, my name is Rishabh Singh, a first year medical student from Eastern Medical College and Hospital, Comella. Welcome to my channel. If you are new here, so please go and subscribe to my YouTube channel. I try to provide you some educational video related to MBBS. I hope you will gain or acquire something new at the end of it. If you like, don't forget to subscribe, like and comment below. Welcome to my YouTube channel. In this video I'm going to talk about the parathyroid gland. So coming to parathyroid gland, they are two pairs of small endocrine gland and they are small yellowish brown bodies which is present in the thyroid gland and they are termed as parathyroid glands. Two pairs of small endocrine gland means it will have one pair on one side and one pair on one side. One pair will consist of two parathyroid gland and one pair will consist of two parathyroid gland. So basically 4 parathyroid gland is present in the human body. They secrete parathormone which will work opposite of calcitonin. Now we know calcitonin is secreted by the parafollicular cells of the thyroid gland and the parathormone work opposite to the calcitonin and maintain the blood calcium level by mobilizing the calcium from the bones. Now coming to the location of parathyroid gland. So there are superior parathyroid gland and inferior parathyroid gland. Superior parathyroid gland location lies in middle posterior border of the thyroid lobe above, at which inferior thyroid artery crosses the recurrent laryngeal nerve. So it will be present above the inferior thyroid artery which crosses the recurrent laryngeal nerve, and they develop from the fourth pharyngeal pouch, also termed as parathyroid 4, and it is constant in position. Superior parathyroid. Now coming to inferior parathyroid. Inferior parathyroid lies on the posterior border of the thyroid lobe near its lower pole below the inferior thyroid artery. So inferior parathyroid will lie below to inferior thyroid artery and they develop from third pharyngeal pouch, also termed as parathyroid 3rd, and they are variable in position. However, superior parathyroid is constant in position, they are variable in position. That means they can present within the thyroid capsule, outside the capsule, and within the substance of thyroid gland. Now coming to the diagram of parathyroid gland, as you can see, this is the location of parathyroid gland. You can see superior parathyroid gland, these two are superior, these two are inferior, and you can also see the inferior thyroid artery which will anastomose with the superior thyroid artery and make an anastomosis here. Now coming to size and shape of parathyroid gland, they are small, oval or lentiform in the shape. Each gland length is 6 mm, breadth is 4 mm, and thickness is 2 mm. The diagram is shown here. This is the parathyroid gland, and you can also see the ascending branch of inferior thyroid artery, suspensory ligament of Barry and pretracheal fascia, and also the weak part of the capsule. Now a question arises that what is suspensory ligament of Barry? So as we discussed in previous lecture in thyroid part, that the suspensory ligament of Barry basically attach the lobe to the cricoid cartilage. So it will attach to the cricoid cartilage and it is formed at the by the thickening of the false capsule, and we know there are two types of capsules in the thyroid gland. Now the size of each parathyroid gland is like a split pea and it weighs around 50 mg. Now coming to blood supply of parathyroid gland. So blood supply of parathyroid gland, it is a gland which have rich blood supply by superior thyroid artery and inferior thyroid artery. Now coming to nerve supply by superior or middle cervical sympathetic ganglia, which is by the sympathetic fiber, and we know sympathetic fiber is vasomotor fiber. Now coming to microscopic structure of and function of the parathyroid gland. So the parenchymal cells of the gland form the irregular anastomosis cords or group of cells. Now parenchymal cells have two type of cells: principal cells or chief cells and auxiphyal cells. Now chief cell will secrete the parathormone because it is maximum in population, and auxophyll cells is minor in population and function is still unknown. Now coming to functions of parathyroid gland. So function of parathyroid gland, it will increase the mobilization of calcium from the bone by the osteoclastic activity. It will increase the reabsorption of calcium by the proximal renal tubule or PCT, and it will increase the absorption of dietary calcium from the small intestine. So basically parathyroid hormone will increase the calcium level in the blood. However, we know calcitonin will act opposite to it and it will decrease the calcium level. So they both act opposite to each other. Now coming to some clinical point, hypoparathyroidism. It may occur during or due to thyroidectomy, which is surgical removal of the thyroid gland, and in this the removal of parathyroid gland also occur. Causes will be tetany, which means low blood calcium level, and it causes the hand spasm, neuromuscular excitability, and also cause carpopetal spasm, convulsions, etc. Now there is an important question that why parathyroid gland is vital for life, as it metabolism of calcium and phosphorus. So that's why it is vital for the life. Now coming to hyperparathyroidism, it is seen in the tumors of parathyroid gland, and increased PTS causes increased calcium level, which causes generalized osteosis fibrosa, and it also causes kidney stone. Now coming to development of thyroid gland. So as you can see the diagram, it is a primitive pharynx, and you can also see this is thymus, this is third part, fourth part, by which superior and inferior parathyroid gland develop respectively. So superior parathyroid gland, it developed from fourth pharyngeal pouch, also called thyroid 4. So it is also called as parathyroid 4. Now coming to inferior parathyroid gland, it developed from the third pharyngeal pouch, and it is also called parathyroid 3 or third. Now coming to congenital anomalies of parathyroid gland, it will be the agenesis or hyperplasia of parathyroid gland and ectopic parathyroid gland. So this completes the lecture on parathyroid gland. I hope you will like this video. If you will like this video, then don't forget to subscribe to my YouTube channel, which is MBBS Studies with Rishabh Singh. Thank you.